Hi, I'm Stephen Jones. At Robert Wood Johnson, we believe citizens need to be informed about the important healthcare issues affecting their lives. That's why we're proud to support the healthcare programming produced by the Caucus Educational Corporation.
Funding for this edition of Caucus New Jersey has been provided by Horizon Blue Cross Blue Shield of New Jersey, New Jersey Manufacturers Insurance Group, auto insurance, homeowners insurance, and banking under the principle of stewardship. The law firm of Gibbons PC, PSC&G, committed to improving New Jersey's economy and strengthening its communities. Verizon Communications. And by Cohn Resnick, providing accounting, tax, and advisory services for more than 90 years. Promotional support provided by the Star Ledger, powering NJ.com. And by NJ Biz, all business, all New Jersey.
Hi, I'm Steve Adubato. It's my pleasure to introduce for the first time here on public television, hopefully it will not be the last, a gentleman who has a lot to say about what's going on in the Catholic Church and with our Pope. He is Father Mark DeStephano, Professor of Modern and Classical Languages at St. Peter's University. How you doing, Father?
Very well, thank you. Thanks for having me.
We have a very interesting Pope, do we not?
He's a wonderful man. I'm just so excited about him. Interesting, lively, I think somebody who's really captured the spirit of the Church. I was praying that at the time of the election that it would be somebody along the lines of a John the 23rd, and he's certainly been that.
Now, as we do this program, literally, as we approach 2014, you know, not only do I have a new iPad, but more importantly, get this, Bob Morris, our great director. Bob, you are not Catholic, but I know you care very much about the Pope. You got this? The Pope is now on the cover of Time. You knew this already, didn't you?
I just heard this morning.
How great is this? He's on the cover of Time, the Man of the Year. You say Pope Francis. I say Pope Francis. You say what? Describe his personality.
I say open, I think reflective, humble, which I think is a wonderful thing. Someone who's given to service, kind, interested in reform, and someone with a strong spirit, I think, too. Someone who's very interested in getting the Church back on track, I think.
We're off track, aren't we?
I think we have been for a while. I think that the Pope would certainly like to see us, and especially in many ways, I think it has to do with us priests. I think he wants to see, and he said this on so many occasions, he wants to see us priests out of the rectories and on the streets.
What does that mean?
And that is so Jesuit. He wants us not to be waiting for people to come to us. And I think very much in the spirit of the Second Vatican Council, he wants us out among the people, in the jobs that they do, in the places where they go. I think that was the spirit of the Council, to get involved in the world as we know it.
The Vatican Council. But Father, you talk about the Jesuit tradition. Most people do not understand the Loyola connection, if you will, the Jesuit history. The fact that St. Peter's is a Jesuit school, and I tell you, my son is graduating from Fordham as we speak right now, a very strong Jesuit school. The Jesuit mission, describe it. It is not the mission I grew up with as a Catholic, and it is not always accepted by many other Catholics.
Yes. It's very controversial. I really don't know why.
You kind of do know why.
Well,
you do know why.
I mean, I think
because some are uncomfortable with it.
Yes, right.
You're just too activist for many.
Exactly, and I think part of the reason is certainly we follow the spirituality of Ignatius, and because of Ignatius of Loyola's own faith walk, so to speak, the fact that he had been an aristocrat and a noble, and the fact that he gave up that life and he felt this call of really having to go out and find God and listen to God in a very special way. When I say find God, I mean open his own mind and his heart. He found that especially along a road that was very difficult for him. So right off the bat, it was testing the different extremes of, you know, would I serve you as a man who has money or as a man who lives in poverty? And he felt that we could not be tied to things of the world. So in that sense, he got rid of anything that had to do with wealth. And I think we see that with the Pope. So I think that's a hallmark of the Jesuit way of following.
And Father, respectfully, given that the Vatican's history before this Pope, in the eyes of many, is perceived to be so tied to brick and mortar,
Yes.
so tied to behind those walls, so tied to what goes on behind those walls that will not be spoken about to the rest of us, be as Catholic or not.
Yes.
It seems to me that Pope Francis is saying no more.
Exactly, and he is already, from what we have seen from his appointments, the new director of the Vatican Bank, this new advisory committee that he's had. The word on the street early on was that he was considering actually closing the Vatican Bank because of
Which has been a lot of secrecy about the bank?
There's been a lot of secrecy, there's been a lot of scandal over the last several decades, and he has made it clear that he does not want to see his papacy go in that direction. And so it's part of a general reform of the Curia. So, I think it's this idea of being with everyday Catholics and getting away from these curial offices, centers of power. That's also a very Jesuit thing. This idea that we are not to hold office, which was very interesting.
Right.
Jesuits are not to be, we were not to accept posts like bishop or cardinal. So I think he's put that very much into play. And he said, we need to be normal priests, if you will, out there with people in their usual work.
And Father, excuse me, more open. Same-sex marriage?
I think you're going to get a hearing from him on that. He's already intimated
A discussion?
This. Yes, I think that's very much a part of our training too. With Jesuits, we're often criticized for this. For a Jesuit, it's always about, whatever it is I want you to learn, it's about questioning everything. I want you to be a critical thinker. If you're going to believe what I believe, it's because you really want to believe it.
The Archbishop in my diocese said there will be no discussion.
In my estimation, that is not something that, I would not say that this is part of what it means to be a true Catholic.
Pope Francis wants a discussion.
Exactly. I would say, and I think that's very much a part of our tradition. Frankly, I don't see how we can say don't discuss something. So,
even if you disagree, he's not saying change the policy. He's saying we can discuss it.
Exactly, and the discussion might lead to changes. I think that's part of the implication. So,
and that includes divorce as well?
Divorce is very much an interest of his, because I think he's raising these hard theories. And I think, Benedict started to raise some of them too, but I think Francis really wants to see this, something done with this.
You see any changes in terms of folks coming back?
I can see just on Sundays, the numbers of people coming back. There's a friend of mine who said he was looking at an atheist website. And a lot of the, quote unquote, atheists are people who were former Catholics. And he said this is maybe a month ago, he said, it was very interesting. He read a number of comments by these atheists who said, maybe with this Francis guy, maybe I need to give this a second look over. And that's exactly what we want, a chance to really implement these wonderful things about the council.
It's a lot to expect from him. He is one man.
It is. It is.
He is one man. This is a massive infrastructure, this bureaucracy, he's one man.
He is, it's true, it's one man. I hope that what he will have behind him is, as we say, the sensus fidelium, the sense of the faithful, excuse me. So
you don't use Latin like that?
I was trained in the classical tradition.
Exactly. In public television, we don't interpret that quickly. Go ahead.
So this idea that, what people, I think what most people are saying, kind of common sense decisions. We need to get back to that common sense Catholicism. And we need to look at issues in the light of developments. So, doctrine is not necessarily going to change entirely, but doctrine can develop over time in different ways.
You're excited?
I'm very excited.
You're not the only Catholic who is.
I hope not.
Thank you, Father. Father Mark DeStephano, who's a professor of modern and classical languages at our friends over at St. Peter's University. Thank you, Father.
Thank you so much. Thank you for having me. Thank you.
My pleasure. Stay with us. We'll be right back right after this. Thank you very much.
If you would like more information on this program, or if you'd like to express an opinion, email us at info@caucusnj.org. Visit us online at caucusnj.org, or find us on Facebook at facebook.com/Steve Adubato, PhD.
There he is, Bill Lovett, Executive Director, New Jersey YMCA State Alliance. How you doing, Bill?
Well today, thank you.
We're talking about this Healthy You initiative that we've been working on for a while in cooperation with the folks at Horizon, the Horizon Foundation. Healthy You is?
Healthy You is a program that's statewide that's designed to influence the healthy eating and active living behaviors of children across the state of New Jersey.
It's been going on since 2008?
That's correct, yeah.
Now, this childhood obesity problem, not new, taken years to get this bad, right?
Right, although we're seeing progress.
What progress are we really seeing?
Well, the latest CDC studies show that
These Centers for Disease Control.
Centers for Disease Control, thanks, is now showing New Jersey as one of the states across the country that is starting to get declines in childhood obesity rates.
Okay, let's set it up, be clear. I mean, Healthy You is a program that is tied to the YMCAs.
Correct.
Is every Y involved?
Yes, 40 Ys across the state of New Jersey.
So let's make sure, as we put up the information on the screen, you see the website, go to that information. It doesn't matter where you are in the state, you can access the local Y. And we'll also talk about the initiative to try to get them into the school, the Healthy You initiative into the schools as well. But what happens at these Ys in connection with Healthy You?
So, first of all, the YMCA is the largest provider of after-school childcare and preschool childcare in the state of New Jersey, with about 30,000 kids a day going to Y programs. And so the Healthy You program affects those 30,000 kids a day using a standardized curriculum that comes out of the University of Texas that really is designed to help kids understand good eating behaviors, help parents get engaged in it, and also have very robust physical activity.
Okay, go back. Standardized curriculum. Are there 3 pieces to this?
Yes. So
what are they?
Okay, so the curriculum comes out of Texas is called CATCH, which stands for Coordinated Approach to Children's Health.
Coordinated Approach to Children's Health. Go ahead.
Yeah, and so that program has 3 components: healthy eating, strong physical activity, and engaging the parents in...
So nutrition, by the way, when you go on the website, you'll get this information. Nutrition, physical activity, and parental involvement.
Right.
Okay, so the nutrition piece, how do you teach it?
So it's interesting. The curriculum is based around something that I think intuitively will make sense to you, which is we teach kids about go, slow, and woe foods. And we try and articulate a way for a kid to look at food and say, that's a go food, I can have all I want. Slow food is something I can have, but it needs to be in some moderation. And
example of the go food, as much as you want.
Okay, a go food is have all the salad you want. Have fresh fruits and vegetables.
All you want.
Yeah, all you want.
Slow?
A slow food might be that it's okay to have some candy for Halloween, but in moderation. Or it's okay once in a while to go to fast food.
Got it.
Moderation.
And the last one is...
go slow and woe. And woe foods really are things that we're saying to kids, you really need it. There's no nutritional value for you, don't have them. And one of the best examples is around the whole issue of sugar-sweetened beverages.
No to that.
No to that.
Why?
Well, there are a lot of studies that are showing, first of all, it's empty calories for kids. So you can drink soda, you're getting the calories, you don't feel filled up, but there's no nutritional value. We're really encouraging kids and parents that they should be drinking water.
And the physical activity part?
The physical activity part is sort of interesting, and think about this is, you know, often the idea of physical activity would be we'd go to a schoolyard and see 20 kids playing kickball, 1 kid rolling the ball, 1 kid kicking, 18 kids standing around. And so this program says to staff and YMCA people, look.
We're looking at a lot of activity right there. Everyone's involved?
Yeah, everyone's involved. So we actually have a way of measuring that. And our goal is that if we're running a class, you and I together, and we have 20 kids, that we have between 18 and 20 of them actively involved in doing things.
Do you train the folks at the Y to get kids involved as opposed to have too many standing around?
Yeah, so there's a whole training that we've rolled out statewide that gives staff the tools and the resources to...
do the last part, parental involvement, because all of us as parents struggle with this one. So with kids who struggle with this issue.
Yeah, so, you know, especially with preschoolers, if you think about it, preschoolers have much less autonomy in their decision making, so we're really trying to educate the parents there around, I'll give you just 2 examples. One is we're really trying to drive home with parents the idea of eating dinner together as a family, not in front of the television. And the second is to really try and limit the screen time that kids are getting at home, both computers, video games, TV, to less than 2 hours. And if we can do those things, the evidence says that it matters.
So Bill, real quick, describe Horizon's interest in this, because I'm not convinced this would happen without them.
So Horizon is sort of interesting in that they take their values and they really put them into practice in their funding, and so they are committed to children's health. And so when they looked at the scale of the Y and the kind of issue they saw around childhood obesity, they were willing to say let's provide funding to really have an impact on a statewide level. And so I think it's really been a terrific partnership.
Okay, so now you got the Y situation going on, and you're the statewide guy, but now we say it's not enough. We got to go into the schools. What's the initiative going into the schools? How many and when?
So we're doing a pilot program where we're in a year or two, but in 3 years we will have 50 public schools that are involved in the Healthy You program. And that's sort of interesting because it really addresses the entire school environment. Everything from recess to before school, after school play, what they serve in the cafeteria, giving kids activity breaks during the day. So it gets the entire school team involved in creating a healthier environment for the kids.
Who picks the schools? Who trains the teachers? How does that work?
Okay, so the schools are picked in a unified way involving the Y and Horizon and looking at school districts. We're trying, especially around the issue of equity, to target districts that have low capacity in urban areas. So we're involved in Newark, Jersey City, Trenton.
Well, they don't have a lot of resources.
Right. Right, so we bring the resources, we bring the training.
Right.
We have the YMCA staff linked into the school where we a lot of times already have those relationships. And so we're really our job is to take down all the barriers to a school being in the program.
But the Y stays involved?
Yeah. Yeah.
You don't step out because it's going into the schools?
No.
And you have to have those teachers, you have to have those administrators to get this done, though.
Yeah, one of the things we've learned is that if the principal is not at the table, our chances of success are really diminished. And it's just common sense. You've got to have the leader of the organization.
Before I let you out of here, the biggest success so far since the Healthy You initiative has started has been? One number, one indicator where you say, hey, we're making some progress.
We've seen significant changes in the nutritional behavior of children, both preschool and after school, in terms of what they eat, what they like, the water they're consuming, fresh fruits and vegetables. When we started the program, we got a lot of pushback from parents when we went to water because they said the Y was being cheap. Huh. That was their perception.
Right.
I think if you ask parents today, they realize that we're not being cheap, we're being proactive around their kids' health.
Changing the way we think, act across the board. Bill Lovett, Executive Director, New Jersey YMCA State Alliance, dealing with the Healthy You initiative. Thanks. Keep us updated, okay, Bill?
Yeah, pleasure to be with you.
Good stuff. Stay with us. We'll be right back right after this.
If you would like more information on this program, or if you'd like to express an opinion, email us at info@caucusnj.org. Visit us online at caucusnj.org, or find us on Facebook at facebook.com/Steve Adubato, PhD.
Dr. Roger A. Mitchell, Jr., Northern Regional Medical Examiner, New Jersey office of the State Medical Examiner. Good to see you, Doctor.
It's good to be here.
You're here to talk to us about what you see in your work every day in connection with the abuse of prescription drugs. By the way, describe your work. You perform autopsies.
Yeah, we're part of the Office of the State Medical Examiner. I run the Northern Region, which is Essex, Hudson, Passaic, and Somerset County. We do all death investigations, and that's non-natural deaths. Deaths that might be accident, homicides, suicides, or undetermined, fall under the jurisdiction of the medical examiner throughout the state of New Jersey.
Now, we met in cooperation with an initiative, the Do No Harm Conference we were doing. Right. American Medicine Chest, our partners with the Partnership for Drug-Free New Jersey, and met you at that conference, and we had a very candid conversation about the seriousness of this problem regarding prescription drugs.
That's right.
How bad is the problem, and what do you see when it's way too late and people are dead lying on a cold slab?
Well, the problem is vast, and we're talking primarily about the prescription abuse problem. 10% of the cases that we see that come into our office, we have about 7,000 cases that come into the office statewide. 7,000 cases. Of those 7,000 cases, about 1,000 of them are drug abuse deaths. And that's the combination of both illicit, common heroin, cocaine, and a combination of prescription, and primarily oxycodone.
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 Oxycodone, that is the primary.
Yes, so let me explain. So 700 of these deaths are prescription drug deaths. 700 of the 1,000 deaths are prescription drug deaths. That's a high number. It's a high number, and that's across the state, right? So 50% of that 700, close to 50%, 48%, have oxycodone in the blood or urine of the individual dying, because they're taking it.
What is that?
Oxycodone is a synthetic opioid. It is heroin in a pill. It is a pain reliever. It relieves pain. But when abused, it can bind to the brainstem primarily, and trick the brain to think that it has enough oxygen when it doesn't. And pretty much you become somnolent, hard to arise, you're sleepy. You become sleepy, hard to arise out of that sleep. You start snoring, and then there's death. So 69% of all prescription drug, 69% of all drug deaths are prescription drug deaths.
Now, when we were at Hackensack University Medical Center that day and we were having this discussion, one of the things that struck me is that when we engaged the physicians at the Do No Harm conference up there that day, and you're smiling because you know where I'm going.
I do.
I asked the physicians, because there's a statewide initiative where physicians can actively participate. The name of that program?
The prescription monitoring program.
The prescription monitoring program. Follow me on this, folks. The state has a whole range of programs here. It's called the prescription monitoring program.
It's Consumer Affairs.
Consumer Affairs. And it's not mandatory.
No, it's not. It's voluntary by physicians and pharmacists.
Physicians and pharmacists can voluntarily be involved. And I asked this group of physicians, right? They were from all over the place, right?
That's right.
But they happened to gather at Hackensack.
That's right.
And I said, how many? And it was not a very high number. And then I started asking, well, why aren't you involved? And people got very uncomfortable.
That's right. That's right.
What'd you take from that?
Well,
because you need physicians to be involved, because they do what for these patients? If they know there's a problem, what should they be doing?
So if there's a problem with individuals abusing drugs, then they have the opportunity to get them the treatment that they need, right? So what the prescription monitoring program does is it allows for physicians and pharmacists to identify when prescription drugs are being averted,
right, or
when they're being overused or abused. Averting is being able to take them and then selling them on an outside market, and obviously the abuse is self-explanatory. And so when a physician becomes aware of that, then their prescription writing practice may change to that particular patient. They may help that patient identify how they can get help for their drug abuse problem. You see, Steve, drug abuse is a public health issue. And that's why it's important to have conversations surrounding this issue with physicians and practitioners.
But doctor, your colleagues, you saw them across the board from hospitals throughout this region, in specialties across every possible area, saying, no, I'm not participating. Some of them thought that if they did, they would be potentially at risk in dealing with law enforcement, at risk with dealing with drug addicts, where they didn't want to find themselves or their staff exposed.
Well,
again, are we all in this thing together or not?
We are. We are in this thing together, and to defense of my colleagues,
yes,
it's a very hard process to engage a patient and have a real conversation with them about their drug addiction. And why is that? Is because really there's a stigma. There's still a stigma surrounding drug addiction and mental health related issues.
Absolutely.
And we really need to have conversations about destigmatizing that particular issue.
A bigger discussion?
A bigger discussion about destigmatizing drug abuse and ensuring that we're taking the step to make sure that it's spoken about in a public health context.
As a disease?
As a disease.
As opposed to a crime.
Exactly. Exactly. So the distribution may be a crime. And the
even
use...
with prescription drugs?
Even with prescription drugs. Even with prescription drugs. There are cases all over the country. U.S. Attorney is bringing cases all over the country holding physicians liable, criminally liable, for overprescribing. Pill mills are all over the country. Primarily, they've erected or been present in Florida, but they're holding people criminally liable. But this conversation is a good conversation. In May, the governor wrote in the Good Samaritan law.
The governor of Jersey, Chris Christie.
That is correct. And that's
Good Samaritan law, 2 minutes left. What is that?
That's the Overdose Prevention Act. That allows for medicine, naloxone, to be administered by individuals that are with people overdosing. without necessarily being criminally convicted of taking drugs themselves. So it protects the caller, the 911 caller, from being prosecuted if they're trying to help save a life.
So it's not just physicians, it's government, it's parents of those who may be abusing prescription drugs. It's nonprofit organizations like the Partnership for Drug Free New Jersey. It's the media. It's all of us.
That's right. It's Project Medicine Drop, which is another consumer affairs, where they're.
What do you do with your prescription drugs?
That's right. That's right. Because you got to discard them. The young people, 14% of all of the deaths are young people less than 25 years old. Right? So you have to lock these things up if you're still using them.
Lock them up.
And you have to discard them properly.
Doctor, we'll continue this conversation. We still have very important work to do, but I thank you for your public service.
I appreciate you.
Good stuff.
Thank you.
Thank you very much. It was important.
The preceding program has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. N13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by Horizon Blue Cross Blue Shield of New Jersey, New Jersey Manufacturers Insurance Group, the law firm of Gibbons PC, PSC&G, Verizon Communications, and by Cone Resnick. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.
I work for Horizon Blue Cross Blue Shield, and I'm a catastrophic case manager. I'm a nurse. I feel a sense of responsibility to each and every member that I speak with on the phone. I know where they live, I know their towns, I know the hospitals they go to. A lot of times I know their physicians, and I love helping people at very difficult times of their lives. The job I have now is the perfect job for me. I think I was born a nurse.